Would you please talk about the effects of smoking that you've observed on the mentally ill?
Absolutely. Smoking is very destructive. The life expectancy of folks that we work with who are severely mentally ill is 25 years less than the average population. That means individuals who suffer from mental health issues, who are severely mentally ill, live on average to age 52. That's devastating. When you think through the lifespan of individuals who are chronic smokers and also have mental health issues, every single health indicator is higher for that population than the average population or general population. For instance, the incidences of diabetes, cardiovascular disorders, obesity are higher than the average population for a variety of reasons. So we really feel it's important to understand the consequences of smoking and the importance of educating the public and the importance of smoking cessation and having smoke-free campuses throughout the county.
It seems that the stressors for people living with mental health disorders are already so high that they would be so much more vulnerable, not just around health impacts, but in every kind of way.
It does seem that way. And I must say the systems of care in the 30s, 40s, and 50s, even through the 60s, contributed to some of the stressors as related to smoking. Years past in the state hospitals, there was what was called a PUF fund, where consumers of mental health issue who were in state hospitals were given packets of tobacco and rolling paper, and smoking was promoted as part of the activities of daily living within the institutions. In our learning collaborative, we've had a number of presentations to a variety of our consumer groups related to smoking cessation and the hazards of smoking cessations, and how you can best free yourself from smoking. And so it doesn't just happen. It would require some continuing education training. I even want to consider for folks who are withdrawing from smoking and those materials, perhaps even a medication to help with that titration away from smoking. I think it's real important that we start early, we educate the public, and we educate consumers on the hazards of smoking and provide them with healthy alternatives. I think the Learning Collaborative has great promise. It is very systematically ran. We're integrating with our partners, and we could actually have a huge impact on the life expectancy as well as the quality of life of every individual who we work with through the Learning Collaborative. In the Learning Collaborative, we're collaborating with our primary care partners and developing plans with our consumers where we're going to help them understand more and perfect self-management of some of their behaviors with support from our community members.
Tom, is there a way, or have you done this already, to educate people who live with folks who are living with mental health disorders to maintain a smoke-free home? Because people themselves, clients and people living with mental health disorders, may not smoke, but people they live with might, and so the impacts of secondhand smoke could be just as disastrous, really.
Yes, I think it's a real important point, Kathy. Secondhand, thirdhand smoke are relevant issues here. Mm-hmm. We would certainly champion smoke-free campuses and smoke-free apartments and living arrangements. I think the first step in that matter is education, lots of education, and having groups of folks who have gone through smoking cessation programs become mentors for other individuals who are struggling with this matter. It's not easily done, but you have to start. And starting is perhaps the hardest piece to get changes in place and moving forward. Mm-hmm. I feel it's important that we have alternatives that versus smoking in an apartment or in a house, that there's consideration for who else lives in the dwelling, and that perhaps there's smoking, if smoking needed to be done, it's done outside the house itself where the premises is. It's not to say that I think the more important piece is smoking cessation and working with folks from starting from where they're at so they can move on with their life. and titrate from smoking and have a better life for themselves and everyone who is around them and their families and significant others.
Do you know of anyone who's quit smoking, and if so, do you have any comments about how that
Yes.
person's health
Yes, I do.
has been
And that's,
affected?
I'm so excited here. Yes, it's great to see the outcome of our interventions and our planning and our processes. I know of a handful of folks who have, over the past year, with some relapses, have successfully maintained a period of time without smoking.
That's
without
great.
smoking. The first thing we usually see is that they're happier. There may be a slight weight increase. We're noticing in some of our studies that we're seeing reductions in certain types of physical ailments. There's improvements in their blood pressure readings. There's also more of a likelihood that these folks not only are stopping smoking and in the smoking cessation programs, they're also replacing that with other types of physical activities, healthy activities, recreational activities. And I've even seen two folks who've gone through a smoking cessation program in the past year and a half. They've even changed their diet and their lifestyle. And I think those impacts are significant and great, and we need to acknowledge those impacts and share the value of the healthier lifestyle and healthy people in our healthy communities.
Thank you for sharing that story, and thank you for speaking with us today, Tom.
You're welcome, Kathy. Thank you.
I was just wondering if you can tell us what McCavin's all about.
McCavin's all about assisting people who have life-threatening illnesses, preventing some of those life-threatening illnesses, doing care coordination for people who have mental health and substance abuse challenges. Some of them also infected with HIV or hepatitis C. Many are not. But we serve people who are sometimes fall through the cracks and are not served by other agencies.
We're just interviewing clients about what it would be like, what was their opinion about having a smoke-free campus. For some clients, I realize that would be here all day long. It's a little more difficult than if they were just coming by for an hour. If they're going to be here all day long and not able to smoke, that brings with it a whole lot of other challenges, I think. And it occurred to me that when I was talking to clients, and began to tell me some of their stories, that and all the clients I spoke with were dual diagnosis clients, so they had both substance abuse disorders and where they were living with mental health issues. So for those people, cigarettes may be their last crutch.
It's a harm reduction measure.
And everyone said it relieves anxiety and that it would be difficult for them not to smoke in the backyard, for example, but some people were in favor of not smoking in the backyard. I realize, though, that we're really talking about, of course, another addiction for people who have been traumatized. The whole picture is quite a lot more complex than we might imagine. When you think about having a smoke-free campus, you think about, well, how can you prevent or help people to prevent, either coming into contact with cigarette smoke, or how can clients actually begin to have access to cessation classes? How could they quit smoking, ideally, I suppose? But then when I heard more about what their lives are like, I thought, gee, I don't know that many people really understand what folks who are living with these challenges have to deal with on a daily basis. So I wondered if you could speak to that.
Well, sometimes that cigarette is the very last thing that they have in the way of a coping mechanism.
So yes, they could walk across the street, but when people who present in the ways that a lot of the clients here present to the public who don't understand them, they're already targeted just by being across the street. And so they're at more risk, and certainly at more risk of being ridiculed and thought poorly of some more.
Stigmatized even more.
Stigmatized, yes. I know that when I interviewed some of the clients, they talked about some of the traumatic experiences they had had as children, and I imagine many of your clients have had traumatic experiences. One of the most compelling interviews I did with McCavan clients was with a woman who said that she's bipolar and schizophrenic and has PTSD, and part of the reason she has those disorders is because she was abused as a child, and at one point her mother had a choice to stay with her stepfather or to keep her, as she put it, and she put her in an alley and said, "Get used to it." She left her there. She was 10 years old. And she says, "A lot of my mental health problems stem from that. Sometimes it feels like cigarettes are my only friend." One of the most compelling interviews I did with McCavan clients was with a woman who said that she's bipolar and schizophrenic and has PTSD, and part of the reason she has those disorders is because she was abused as a child, and at one point her mother had a choice to stay with her stepfather or to keep her, as she put it, and she put her in an alley and said, "Get used to it." She left her there. She was 10 years old. And she says, "A lot of my mental health problems stem from that. Sometimes it feels like cigarettes are my only friend." She says that smoking seems to calm her down when she's really distraught. So it is hard to give up, but she's interested in joining a cessation class, and if her friends at McCavan would be in the class with her, that would be even more encouraging, she says. Another client I interviewed at McCavan, who's a man that's been smoking since he was 9, said that he had recently tried to quit again. He's quit several times, but he only quit for about a week, and then he got stressed out and started again. And he also said it takes away hunger pains. So for the homeless population, it's probably extremely challenging to quit. However, he is also interested in being in a cessation group, again, especially if his friends at McCavan were in the group with him. And he's concerned about the negative health impacts for him. He said he'd started to cough at night, and he knows it's from smoking. And he's afraid of dying, like his mother, who passed because of emphysema. He said it's like slow suicide, smoking is, because it's intentional. He's in favor of having a smoke-free campus at McCavan. He said he didn't see why people couldn't just go across the street or somewhere down the road if they needed to smoke. But he hopes that more people will be interested in joining a cessation group. So for McCavan, that may be the first step to help educate clients and to help them come together to participate in a cessation group, if possible. And I think the next step, it seems, would be to work on a smoke-free environment, or at least having part of the property smoke-free more than is smoke-free currently. It's a good start.